So after first section, now we know what tracheostomy is. What are the functions of tracheostomy? What are the indications of tracheostomy? Now in this second section, we will talk about different types of tracheostomy. And different types, it might be emergency tracheostomy or elective tracheostomy. And then we will talk about what are the different types of elective tracheostomy. So the types of tracheostomy, we have emergency, which can be performed in emergency situations. Then we have elective or tranquil tracheostomy, and then permanent tracheostomy, percutaneous, dilational tracheostomy. So these are different types of tracheostomy that can be performed. Emergency, elective, permanent, which cannot be removed later on and it stays. And then we have percutaneous, dilational tracheostomy. Mini tracheostomy, which is also known as cricothyroidotomy. So these are different types of tracheostomies that we can perform. First, what emergency tracheostomy, as the name shows, this is the tracheostomy performed in emergency situations. Employed when airway obstruction is complete or almost complete. So when there is no breathing at all, complete airway obstruction, we need to perform tracheostomy in emergency without wasting any time, because that's very, very important for the survival of the patient. So emergency tracheostomy when there is complete or about complete obstruction of the airway. When there is urgent need to establish airway. Intubation or laryngotomy not possible in such cases. So condition in which intubation is not possible, and tracheostomy is required in emergency because there is complete or near complete obstruction of the airway. That all these are the indications when we need to perform emergency tracheostomy for patient to breathe. Next, what is elective tracheostomy? This is the tracheostomy which is not in emergency situation and perform. This is planned, unhurried procedure. All the procedures which are planned, unhurried, they are known as elective procedures, elective tracheostomy. All operative surgical facilities available. Now this is performed in planned circumstances. So all the proper facilities which are required are available. Endotracheal tube is inserted and local or general anesthesia is given to perform elective tracheostomy. If you just see the anatomical position, here this is the epiglottis, thyroid cartilage, vocal folds, this is the esophagus, and then we have tracheostomy tube with stoma made on the surface of the skin. So tracheostomy tube, and this is an elective procedure, it's not an emergency procedure. So endotracheal tube is inserted, anesthesia is given because we have time to perform all these steps and procedures. Or often temporary and is closed when indication is over. The elective tracheostomy is temporary. We remove the tube after the indication is recovered. Types of elective tracheostomy. We have therapeutic types of elective tracheostomy, which are to relieve any obstruction, remove the secretions, and give ventilation. So these are the therapeutic indications of the elective tracheostomy. We need to remove any obstruction, secretion, and to give any assisted ventilation. Next is prophylactic indication of elective tracheostomy. Prophylactic is the term used to steps taken to prevent the condition prophylactically, to avoid the condition that can occur by performing the procedure. To guard against any anticipated obstruction, aspiration of blood, pharyngeal secretion as in extensive surgery, surgery of the tongue, floor of the mouth, and mandibular resection or laryngeal fissure. So all these are the different indication we can say of elective tracheostomy can be performed therapeutically to prevent some condition, or therapeutic means to treat some conditions, or prophylactically to prevent some conditions to occur, to prevent aspiration, to prevent obstruction that might occur. So these are the indications of the elective tracheostomy. So that concludes our section 2. Thank you for watching sqadia.com.